Childhood obesity. Childhood obesity is a growing epidemic in the United States. It affects more than 30% of children, making it the most common chronic disease of childhood. This number has more than tripled since 1980. Childhood obesity is a health issue. Today, more and more children are being diagnosed with diabetes, hypertension, and other comorbid conditions associated with obesity and morbid obesity. A child is defined as obese if their body mass index for age or BMI for age percentile is greater than 95%. A child is defined as overweight if their BMI for age percentile is greater than 85% and less than 95%. How obesity affects children. Overweight children, as compared to children with a healthy weight, are more likely to develop many health problems such as high cholesterol and high blood pressure, which are associated with heart disease in adults. Type 2 diabetes, previously considered an adult disease, has increased dramatically in overweight children and adolescents. Children at a healthy weight are free of these weight-related diseases and less at risk of developing these diseases in adulthood. What are the mental health effects? The most immediate consequences of being overweight as perceived by children themselves is social discrimination and low self-esteem. In a recent study by Schwimmer at 2003, obese children rated their quality of life with scores as low as those of young cancer patients on chemotherapy. In the study, 106 children aged 5 to 18 filled out a questionnaire used by pediatricians to evaluate quality of life issues. Children were asked to rate things like their ability to walk more than one block, play sports, sleep well, get along with others, and keep up in school. The results indicated that teasing at school, difficulties playing sports, fatigue, sleep apnea, and other obesity-linked problems severely affected obese children's well-being. Interestingly, parents answered the same questionnaires, and their ratings of their children's well-being were even lower than the children's self-ratings. What parents can do. Obese children need a thorough medical evaluation by a pediatrician to consider the possibility of a physical cause. In the absence of a physical disorder, the only way to lose weight is to reduce the number of calories being eaten and to increase the child or adolescent's level of physical activity. Emphasize healthy eating. Keep fatty and sugary snacks to a minimum, and keep fruits, vegetables, and low-fat snacks available. Increase physical activity, perhaps by taking a few brisk walks with your child each week. Let your child know he or she is loved and appreciated, whatever his or her weight. An overweight child probably knows better than anyone else that he or she has a weight problem. Overweight children need support, acceptance, and encouragement from their parents. Be a good role model for your child.
Getting kids moving in school, and see why it can play such an important role in ending this epidemic. A report by the President's Task Force on Childhood Obesity says,
schools are a key setting to focus on, given the significant portion of time children spend there. Schools can undertake a combination of strategies and approaches to help children be more active, including maintaining strong physical education or PE programs that engage students in moderate to vigorous physical activity for at least 50% of PE class time. You might think that's already happening at most schools these days. Unfortunately, only 3.8% of elementary schools, 7.9% of middle schools, and 2.1% of high schools provide daily physical education for the entire school year for students in all grades. The U.S. government's Healthy People Objectives for the nation has included goals for active PE since 1990. Active PE has been cited as a way to combat childhood obesity by numerous research studies, brain research experts, organizations like the American Heart Association, Robert Wood Johnson Foundation, the CDC, and even the President's Task Force on Childhood Obesity. The data are there and the scientists have spoken. Quality active physical education works to counter childhood obesity.
if the adults are right, then why doesn't every kid have quality PE? In the last few years, many school systems have eliminated or cut back on physical education to either save money or spend more time on other subjects. That doesn't make sense. A number of studies show that students who have quality PE at least 3 times a week and other school-based physical activities increase or maintain their grades and scores on standardized tests, despite spending less time sitting in class. Physical activity stimulates the body and the brain. It's that simple. But studies also show that not all physical education classes are created equal. Have you ever seen a class where 30 kids stand in line waiting for a turn? Or sit for 5 minutes while attendance is being taken? Or play a traditional game of soccer with one ball and 22 kids trying to share it? Have you heard of PE classes that only meet once a week for 30 minutes? Only offer PE for 9 weeks, then not again the rest of the school year? PE without enough quantity and quality won't help stop childhood obesity. We need HOPE, Health Optimizing Physical Education. HOPE focuses specifically on the public health goal of developing lifelong physical activity and supporting healthy food choices. Changing traditional programs toward HOPE doesn't require that all the objectives of current physical education be abandoned, but it does call for them to be reprioritized. We can do this. We have to do this. There are a lot of challenges we kids will face growing up. Some are harder than others, like making sure our schools teach HOPE, Health Optimizing Physical Education.